Well, good morning. And for those of us in southern Iowa, happy snow day. And for those of you in the northern part of the state, we got socked. I'm in Johnson County, Iowa. We've got about 10 inches of snow in Des Moines through Iowa City. We're socked today. So sadly, we did postpone Hill Day. And I've got some more information about that I will offer here towards the end of the webinar, but we will reschedule and it will be a little bit different than we had anticipated, yet it will still happen. And there are things that we can do between then and now. So I'm going to start. First of all, my name is Geoff Lauer. I'm the Executive Director, CEO of the Brain Injury Alliance of Iowa. I've been on staff for nearing 20 years and in the brain injury field for a few more than that. So welcome to those of you who are listening in real time, IRL, and also those of you who might be listening to a recorded version of this that we will be posting on YouTube within the next day. Let's see a bit of an overview of what's going on in Iowa's legislature this year and across state government. Certainly this year is characterized by one of the two main parties, Democrats and Republicans. The Republicans have control of both the House and the Senate, and they had Governor Reynolds, as a Republican, is in the executive office. And so with that kind of trifecta, there are many bills that have been fast-tracked and moved through the legislature. The school voucher option, state consolidations have been moving forward. There are gun rights on the radar screen, and other major Republican agenda items are moving through. But yet, and still, there are a whole range of other issues that affect Iowans with disabilities, including brain injury. And let me just touch base on a couple of those that are some legislative and some state policy based. In the policy area, there has been considerable state consolidation of departments, both already manifested and proposed. The Department of Public Health has merged with the Department of Human Services, creating Iowa's Health and Human Services Department. And that integration continues, making it the largest state agency in the state. In addition, the Department of Aging is destined to be merged into Health and Human Services later this year. And so we will have a number of agencies that have had independence and interdependence working together. There are pros and cons. I would say from a brain injury perspective, we feel at the Brain Injury Alliance that there have been more pros than cons at this point, particularly for our brain injury community. But there are still potential concerns on the horizon for how the state moves forward if and as they may integrate and merge programs within those organizations. In the Medicaid world, there are a number. There's actually at least three major things happening, and that affects perhaps close to half of the people that work with the Brain Injury Alliance of Iowa as clients of our resource facilitation program. Probably the most imminent piece, two pieces, are one, the Medicaid extended or continuous coverage requirement that expanded and extended coverage to people during the pandemic is slated to end on April 1st. And so for individuals on Medicaid that have been automatically requalifying for the last couple of years, there will be a return to annual assessment, evaluation, maybe a little bit more scrutiny about the service eligibility issues. And then in addition for people that did qualify for pandemic coverage, that is not guaranteed past April 1st of this year. That's number one. Number two, again, in midsummer, there is an additional managed care organization joining the other two that are on board in Iowa. The new one is called Molina. And as in the past, there will be some randomization of reassignment of individuals with Medicaid coverage from their current carriers, Iowa Total Care or Amerigroup, to Molina. There will be choice during that reassignment period for people to come back to where they might want to be, their prior coverage. However, it will take some request in paperwork, electronic communication, and likely vigilance for folks to perhaps stay with the same case manager that they've had if they've grown accustomed and have a good working relationship. Otherwise, there's the issue of having to navigate a new case manager for yourself as a person with a brain injury or your family member if you're working with a family member. The other piece that's on deck is the Department of Human Services last year farmed out a large project to a research group called Mathematica to analyze Iowa's home and community-based service system, the Medicaid waivers, in addition to community-based services. And the initial reports are out from that support the general soft interest, and I guess I would just say the grapevine writing on the wall that the Department of Health and Human Services is strongly interested in consolidating the different waivers in a way that decreases the variability between waivers. Some waivers have employment services on deck. Some waivers have different caps for home and vehicle modifications than do others. So to try to bring both the expenses of people on various waivers better into alignment, the costs, as well as the service array. We will be vigilant about that because in some ways, in some areas, the brain injury waiver has a richer constellation of benefits than comparable waivers. And in others, it has a lower constellation of benefits and supports. As you can guess, there are pros and cons for the brain injury community in that. And there are pros and cons for the disability community in general regarding equity and eligibility. So those are some big considerations in the area of funding. So this comes back to the legislature. There is strong and yet unclear outcome, but strong debate regarding what to do with Iowa's surplus of funding and whether or not, but I believe it's probable, to cut taxes in a way that decrease future income revenue to the state of Iowa. And of course, that has a threat to the state's ability to continue to keep up with healthcare and other cost of living expenses in both the Medicaid and other service delivery areas. And also in terms of the post-pandemic burst of funding that's been available for a couple of years that has come out to regions, to counties, to cities, that has been able to bolster local control over the allocation of funds for local community needs. Some of those funds bode disappearing at the federal level without being backfilled at the local level. One other dimension of this is that last year, the legislature changed the funding mechanism for the counties/regions mental health and disability service system and moved that from a property tax-based system with more county and local/regional control to being state funded, which means they also have the power to, now the state legislature, to change how the funding works, how much funding goes to it, and whether or not there is some degree of folding those services, the mental health and disability service system with CORE and CORE Plus services, to use the jargon within that world, folding that into a more integrated statewide community service system. Again, pros and cons for that. Less local control, more state control, perhaps. So in the midst of all that, the Brain Injury Alliance has been active as a voice. We've had both our lobbyists and our voices present in the early days of the session. There have been some very draconian bills that have been posed that have not made it out of committee, which means that they're kind of dead for the year. There are some that are still in play, and there are some that have moved forward to being passed, one of which is the school reform bill that had vouchers for private schools. Brain Injury Alliance was not inherently against the private school funding. We were concerned, as are many disability organizations, that there were not requirements for the same protections for a free and appropriate education for children with disabilities within that legislation. And so those kinds of changes that affect children with brain injury, children with other disabilities are front and center. However, that bill moved through and the governor did sign it. And we might have to turn to courts, hopefully, to support the federal law that requires a full, free, and appropriate education when using funding. But let's move to a bit of focus on the Brain Injury Alliance's 4 policy focuses, or foci. I'm not sure what the right word is for that. And then we'll have time for questions and answers. In the Q&A section, actually in the chat section of this Zoom meeting, for those of you who are here in real time, you're welcome and encouraged to ask any questions you might have about these policy issues and or other policy issues. And we'll take some time at the end of this webinar when I finish up to run through those. And if you're listening in the future, you can send questions to info@biaia.org, info@biaia.org, and we will do our best to respond to you as quickly as we can. That said, let's bring up the first screen, which would be policy issue number 1. Thank you so much, June, for doing that. June Klein-Bacon, our Associate Director at the Brain Injury Alliance, has given me a hand today. Very much appreciate that. So this is our policy brief number 1. And this is asking for appropriation. This goes to the Health and Human Services Appropriation subcommittees in both the House and the Senate for consideration, and then recommendations to the full Appropriations Committee. And we've been in discussions with the leadership on those committees since the summer on the funding need to keep pace with services and supports for Iowans with brain injury. And in specific here, we're looking at Iowans with who are waiting for Medicaid, home and community-based services, Iowans living with stroke, and Iowans living with long COVID. And then finally, to support some additional brain injury training for community-based providers. So the math that we've done suggests or shows that this amount of money would support a total of about 600 additional clients that would be able to work with the Brain Injury Services Program Neuro Resource Facilitation Program, as well as increase the outreach of that program to Iowans who are in that waiting zone. There are more than 1,400 Iowans that are waiting up to 5 years for a funding slot for the Iowa Medicaid Home and Community-Based Services Waiver. That's bullet number 1. The funding will support additional Iowans in that area. There is a letter that goes out to Iowans who have newly applied for the waiver and been put on the waiting list and or rejected from the waiver that has a link, a description of the fee-free services for people with brain injury that are available to them through the Neuro Resource Facilitation at the Brain Injury Alliance. that is again supported by the legislature through the Brain Injury Services Program at Iowa HHS. So this would be some additional funds to do outreach to those 1,400 people. We know from past experience that not all 1,400 people would perhaps qualify for the services because they may not have a brain injury. They may not be income eligible. There may be different reasons. We would serve them regardless of income if they have a reasonable explanation for how their needs for services are related to a brain injury, as we always have. The goal of resource facilitation is to meet people where they're at in the recovery process from brain injury, both medically, physically, cognitively, as well as financially, because we've learned that if we work with people long before they may need state services, and we can help them maintain employment, maintain more family cohesion, keep people and their families from having to lose insurance or lose jobs, keep them from ending up perhaps in jail or in prison or in other expensive services. We know that early intervention is the key to saving long-term negative outcomes, both personal, financial, familial, from brain injury. There are also people in Iowa with stroke that we at the Brain Injury Alliance have been more focused on in the last year. Stroke is an acquired brain injury, and we've been doing outreach at the Brain Injury Alliance with support from the American Heart Association and with our colleagues at the nonprofit On With Life to connect earlier to folks who are getting discharged with stroke so that they have services and supports as early as possible. That doesn't mean we're not paying attention to folks without stroke, with other causes. We're doing that as well. But again, we've focused on the realization that more Iowans are surviving stroke than ever before. There are more sophisticated treatments, particularly for people who have stroke from blood clots. And again, more younger Iowans are surviving and living with stroke. So we're moving into serving, again, it says 150 Iowans in that area more. And then long COVID syndrome is increasingly recognized as having resulted in or been resultant from the pandemic. There is a significant percentage, 15 to 20% of people who end up with longer term symptoms related to COVID. And of those, about 20 to 25% report neurological and cognitive challenges, brain fog, memory issues. And the literature shows that there's significantly higher risk of unemployment, depression, substance abuse, moving on to state programs as a result of those conditions. There was a piece out that came yesterday that was a little encouraging, that after 24 months, people who are reporting some of the neurological and cognitive challenges begin to feel like they're starting to either adapt to or recover from long COVID. Not clear which one it is, but we'd like to do what is in our mission, which is to support people with brain injury, of which COVID-19 can cause, at least in the short and midterm, and likely for the long term, so that folks can live well and get access to services and support. So outreach and services. Then the final piece here is that because of a lack of cost of living increase in the brain injury services program over the last couple of years, good news, it's been level funded. Bad news, it hasn't been given a cost of living increase, but as we all know, inflation has gone up. There have been dramatic reductions to the statewide capacity of that program to provide specialized brain injury training and education to Iowa's community service providers. And so we're looking for some funds that would go into that component, about $80,000 to $100,000. Our rationale is clearly, we know that investing in these programs saves Iowans a huge amount of personal struggle. The folks that we work with consistently report better outcomes than folks, than the general population with brain injury, because our resource facilitators provide intensive specialized brain injury supports. They are certified brain injury specialists. They know the human service delivery system. We support continuing education, and we've just got a great team. We've got one of the leading resource facilitation programs in the country. We work to be data-driven, and we have a commitment to continuous quality improvement. So we get better by recognizing where we may not be as robust as we should be. So we save Iowa money as well in terms of health economists' analysis. We've had independent health economists look at this program and how we analyze the outcomes, and we've saved Iowa money. For every dollar that comes into this program, there's close to a 200% return on investment. And that return on investment comes from not having people end up on Medicaid, end up in prison, end up in psychiatric inpatient settings, or in expensive out-of-state placements. So this works both in the quality of people's lives and the quantity of state funds that are expended in the future. The other piece here is that we have continued to have referrals with stagnant funding to the program. And we understand that for people who are on the brain injury waiver waiting list, we want to be able to intersect them earlier and more vigorously than we've been able to in the past. So if you have questions about that, June is monitoring our chat box. Please pop that in if that's an issue. That's our appropriation ask number one. The second appropriation ask in our policy brief number 2 for spring of 2023. And June, please interrupt me if there's a question that comes in, okay?
Of course, no questions at this time, but as Geoff said,
problem.
Feel free to put them in and we will discuss.
Good. And anybody who is, you can ask a question on behalf of somebody else who I may have used an acronym that doesn't make any sense, or that you might think that there should be a deeper explanation. Sometimes those of us who are in the midst of a field or a policy speak jargonish. I'm trying not to do that, but I'm sure I'm missing the boat. So number 2, policy brief number 2, to appropriate an additional $6 million in funding to reduce the waiting list for the Medicaid home and community-based service waiver. This would be funding that would decrease the waiting list by about 225 individuals, which functionally would reduce the waiting list by about 500 individuals, close to a third. And our goal would be to try to drop this down a third in the coming years. In the past, we've asked for the whole kit and caboodle. We've got a more conservative fiscal environment than in the past. And so we're asking to try to come down by a third. Why a third? How would that translate into 500 people, you might ask? I would ask. Even though we think this would end up supporting 225 people, the uptake, once people come to the front of the list, about 50% of people qualify. So again, if we think about the 1,400 Iowans, our best ballpark guess is that somewhere between 750 to 900 Iowans would be eligible. So we'll just use the kind of the 50%. Historically, I think it's probably an average of 50% are eligible. That we would have that waiting list reduced by about 500 people, which would be great. This would also reduce the waiting time for the rest of the folks on the list by some measure. So this funding, again, 225 people. We know that services in brain injury, it's quite clear that delaying services and supports for people with brain injury can never be made up. The impact of early intervention and support is fundamentally documented as having much better outcomes for people with brain injury and family members, both in Iowa and internationally. So services delayed in this case are clearly services denied. Brain injury recovery is rapid, most rapid and robust early, with specialized knowledge and intensity for both rehabilitation and community-based services and supports. Brain injury is a chronic condition, and the reality is that people, families have to figure out how to manage, self-manage brain injury after it happens. And having some guidelines and guidance and supports in how it's worked for other people, for how the evidence-based, promising, best practices are out there and available. Our staff have those at hand, and they've been taught to some extent by people with brain injury and their families what works, which we're greatly appreciative of in terms of having worked with people with brain injury for more than 40 years. We've got 40 years of experience to lean on in surviving and thriving after brain injury. The piece here with the $6 million is that it would draw down more than $6 million from the federal government, because there's a match between what the state puts in and what the federal government puts in for Medicaid. And so without getting into all the details and percentages, it's about 50-50. It varies. I think right now it's maybe more 61-49, with the feds putting in 61. So this is the amount that we're asking for this year, $6 million to impact and decrease the risk of jail, prison, hospital stays, mental health, substance abuse, homelessness, unemployment, disability, and other bad things that happen to people with brain injury more often than the general population. Again, please ask any questions you might have here, or if you're viewing this after on YouTube at some point, you can email the questions to info@BIAIA.org. Moving into item number 3, brain injury policy brief. So this is not appropriations anymore. There are 2 specific bills that we've been following that have an impact and can have a wide impact on Iowans with brain injury and their families. One of which relates to the issue of guardianship and conservatorship in Iowa, both for children and adults, for minors and adults. The Brain Injury Alliance, maybe 3 or 4 years ago, was asked to serve by the Iowa Supreme Court on a statewide task force on this issue for 2 reasons. One was to be able to have the voice of brain injury at the table as they discussed how to best support what they then called wards of the state, because these are court orders for guardianship and conservatorship. And in this bill, to change that from wards to the term protected persons, by the way. And it's a minor change, but it's still a change that people who have guardianship and or conservatorship really don't want to be labeled as wards. We like person first language. So persons who need protection would probably be more robust. I'll have to go back and talk about that. But in any event, people who are ordered to have some financial and planning protection because they have not been able to or are not yet of an age to manage their own planning for where they're going to live, what their healthcare is going to be, and what kind of funds are available to support that. There are nearly 23,000 Iowans whom the Iowa courts have appointed a guardian or a conservatorship for. Adults in this area would be known as protected persons, and they've been identified by the courts as lacking at some point, either temporarily or for at least the foreseeable future, the decision-making capacity due to conditions such as dementia, intellectual disabilities, brain injuries, or mental illness. So brain injury is absolutely in here. And there are also people, as a result of having guardians in charge of many of the decisions in their lives, or conservators, they're at risk of abuse, neglect, and financial exploitation. And there are some significant stories, significant not just in intensity, but in frequency, of exploitation by guardians and conservators. So the Brain Injury Alliance is supporting the Iowa Guardianship and Conservatorship Association in this effort to increase uniform and consistent reporting requirements for conservators as well as guardians, meaning that they would have to actually put together a plan that would be reevaluated annually, that would have included what's the plan for where people are going to live, what's the plan for how their health is going to be managed and accounted for. Will they get, they have to get a doctor's checkup every year. What's the plan for their dental health? That somebody's watching and ensuring that the core physiologic and safety issues of people and beyond just those core issues are considered and addressed. And at the end of the year, a brief report on how that went, and that the courts would review that, have an eye on it. The judges would review that, have an eye on it. And if those plans were not adequate or that they weren't being met, the court would pause and put out an inquiry. What's going on here? So that a judge who might suspect abuse, neglect, or exploitation would have the ability to intervene and could, or may, doesn't have to, but may refer cases of abuse, neglect, or exploitation to the county attorney for review and possible intervention. So this is, again, the law SSB 1146. It's an act concerning creating administration and termination of adult and minor guardianships and conservatorships in Iowa. There's, by the way, a counter bill to this, or this is actually countering another effort that would significantly remove reporting and accountability from guardianship and conservatorship in Iowa, that would strip it down by creating two tiers, a low reporting, which you might even call a no reporting type frame, which would probably capture the majority of Iowans in this 23,000 population, and then a tier two, which would be for people who are more at risk. The subjectivity there is of concern to us, and so we just want to make sure that Iowans with brain injury and Iowans with other disabilities, our elders, have some degree of accountability if and when they have guardians and conservators. And then finally, our policy focus number 4, and this is at a point in time, by the way. We've already been engaged and weighed in on probably more than a score of bills. We've been engaged in developing and crafting a number of bills that have gone before the legislature. These are the ones that are currently in play that really can use some significant advocacy support to move forward. Our colleagues at the Epilepsy Foundation have communicated with us and asked us to lean in to support kids with epilepsy and or seizure disorders. We already know in the Brain Injury Alliance that a significant number of people with brain injury, including kids, end up with seizure and or seizure disorder and or epilepsy. So there's a much higher frequency after brain injury. And I crunched some stats. We have more than 20,000 Iowans that live with epilepsy and a seizure disorder. And when we apply the statistics of how many K through 12, kindergarten through 12th grade, those age groups, 4,000 of those should be expected to be kids who are at risk of having seizures occur when at school. The incidence of epilepsy, as I said, is much higher after brain injury. And what this bill would do would be to institute a consistent training program, education, training, and awareness around how to respond to a seizure disorder, who to contact in the school, and that somebody in every school, because we don't have school nurses on deck at every school, but somebody at every school would have some training, ideally by the school nurse, and I think that's what's laid out, to use rescue medications, which are now available nasally, which used to be only available through suppositories, and that has its own issues. But there's been a shift in this. So rescue medications, and then there are some simple devices, vagus nerve stimulators that are turned on by putting a magnet up against a activation device on a child's body, typically in their upper chest area, and so that they would have some training in how to use these devices. The issue here is that there has to be a seizure action plan or a seizure response plan so that school personnel know how to respond to this in the shortest time possible. Because in this case, like any other seizure situation, time is brain. So we're supporting Senate File 177, which would establish a consistent statewide training program, consistent with training programs and guidelines of the Epilepsy Foundation of America. There would be a development of a seizure action plan for at-risk students. Parents would be the ones that would be able to ask for such a thing or choose not to have one. And that if there was one chosen, there would be identification of a key school personnel that could include, but might not be limited to, school nurses who could administer seizure rescue medications and or treatments. I will put in a caveat. The only people who would be, if the seizure medication was being administered through a suppository, it would only be the school nurse that would be allowed to do such. However, again, as I mentioned, there are other modalities for some rescue medications. And this bill would also create immunity from liability or any claims or for injuries or damages when a school personnel is doing their best to assist a student, so that the concern from school districts over, whoa, what if the person squirted too much into somebody's nose, or what if they didn't fully activate a vagus nerve stimulator? We want people to know how to best support students with seizures. And so trying is what we're looking for. And again, these are not complex treatments. These are not complex responses. They're in line with what schools have to do for other much more complex medical conditions. Again, children are entitled to a free and appropriate education, and this is not a degree. Seizure disorders are not something that preclude kids from being able to have one in schools and in our communities. All right, questions. I invite somebody to ask any question. Otherwise, I'll pretend that there was a question asked here in chat and answer it myself. Let's see, we do have 2 chat questions. Or I see that there might be 2, June. No, those are chat comments that we put out there. Any of our staff people who might be on the call that would like to ask a question on behalf of our constituents or themselves? Please type in when you get a chance. As you think about doing that, I would also like to encourage folks to visit that we're going to put in chat right now, and we'll put a link on this up on our YouTube page in the comments section. We have an annual needs assessment that comes out that asks professionals, direct service staff, family members, people with brain injury especially, what are the challenges, what has improved, what has gotten worse, what are the changes you think that the Brain Injury Alliance and or state government, local government should address to respond to the needs of people with brain injury and their families. It's a needs assessment. June's putting the link for our annual needs assessment in our chat box right now. That may or may not be available easily on YouTube. Again, we'll put it in the comments there. So if you look in the comments on YouTube, that would be one of the first comments we've inserted. And that helps guide not only us, but the Advisory Council on Brain Injury and Iowa's Health and Human Service System. I'm sorry, I just got an echo. The Iowa HHS system in how it responds to brain injury in the future.
It appears that Mr. Tom Brown has come off mute. Tom, did you have a question that you wanted to ask?
I did, thank you. So Geoff, as you were giving the overview of the waiver restructuring that is on the horizon, it made me think about, what's the difference between the waivers? And you were talking about service difference. However, I think another major difference is that the brain injury waiver is not a long-term care waiver. It is a rehabilitation waiver. So there may be an opportunity from a policy and advocacy standpoint to have two brain injury waivers. One, maintain the current rehabilitation waiver with a higher reimbursement rate to providers that would help to facilitate transition of people from hospital and facility-based care into the community for then eventual transition to a long-term care brain injury waiver, which may be part of that other mega waiver, if you will. You didn't use that term, I'm using that term, but so that there's a long-term services and supports services for individuals with brain injury within that larger long-term care waiver, but then maintain a rehabilitation waiver with higher reimbursement and of course higher service levels.
Very good point. And I'll just point out that Speaker Tom Brown is former chair of the Advisory Council on Brain Injury. Thank you, Tom, for that suggestion. That makes a lot of sense. I think what we will do, and it's going to be essential for us, if there is a table to sit at in the process of this reorganization, if again the reorganization goes forward. I know HHS has a lot on their plate in terms of absorbing Department of Aging, and again Governor Reynolds is suggesting folding additional state agencies into HHS in the coming year. Add that to the onboarding of a new managed care organization, and it's unclear whether they're going to have the bandwidth to restructure the Medicaid waiver in the short or midterm. But these conversations are happening, and I think that's a great suggestion to bring to the table the potential for the short-term intensive rehabilitation component, increasing the access for that, having a way to screen for that when people apply for the waiver, and then potentially transfer from that to perhaps a lower degree of intensity, frequency, scope for longer term care. Good call. We've done that in a way historically by launching the service program, community-based neurobehavioral services, which provides a degree of intensive Medicaid service and support to people. But there have been, as I know you well know, there have been obstacles for how do people get that next step level of support, as opposed to kind of falling off the intensity cliff as they might change from CNRS, community neurobehavioral services, to the Medicaid waiver. Thank you.
Geoff, we've had another question come in. Can you speak to how individuals can engage in advocacy efforts from their homes?
Yes, thank you. That's on the agenda. So perfect transition for that. Whoever asked it, thank you so much. So the legislature has a website, and June can post that here as a link. and we can put that again in our comment section on the YouTube video. What you can do is you can find your legislator, and we will put that, in addition, we will put that kind of a link up here and in the YouTube video. Finding your legislators that are both your representatives in the Iowa House and your senators, again, in the Iowa Senate, is helpful. To send a note or send one of these, you can send the document, the brief to them that you have, plus a reason maybe in your email description about why this is important to, and then here's where you have options, why it's important to you, why you think it's important to your neighbors, why it's important to people with brain injury. It helps when you give two kinds of information. One kind of information is a little bit of a story, a heart information, why this affects people in their lives, or why this affects you in your life. Again, 1 or 2 sentences by email or a phone call to that representative and a voicemail asking for them to call you back, and they generally will, or you may reach them at the State House. So an email or a voice or voicemail, giving them the reason this is important to you, and then also some hard data, which we provided a little bit in these briefs. If they come back and say, I need to know more about some technical component, or how did they come up with the dollar signs on this? Please, please, please refer them or call, email us at info@BIAIA.org and say, you know, Representative Gustafson has asked me, how did you come up with $6 million for 250 people? I will reach out, or one of our team will reach out to the representative to follow up with him or with her, depending on who you're reaching, or with them, depending on who you're reaching. So an email is effective. Senators and representatives do read their email. They do typically respond to their local constituents a little bit more vigorously than others. And there are times when we might ask you to email or call a committee chair, either in a subcommittee or a full committee, particularly in the coming weeks or month, to request support for a specific issue. And again, we will provide you some of the harder data, but adding your experience, why you feel strongly about this issue, helping an elected official understand that there are constituents in Iowa that either work in the field or live with brain injury. Thank you.
And I have in chat added the link for the Find Your Legislator, if you're not familiar with who your legislator is. In addition to that, you are welcome to download each of the policy briefs from chat. Those were also on the email that went out yesterday to invite you to this session. So you have a couple of avenues to access those policy briefs in PDF format.
So thank you, June. So summarizing, it's a big legislative session. These are 4 areas of focus that we give to you as a distillation of what we think are potentially the most impactful and, it's not a word, but I'm gonna use it anyway, tractionable areas that would have broad impact, statewide impact on people with brain injury. There are 2 that have to do with funding. There is our Iowa savings accounts for the state are chock-a-block full. The state and our legislators have a choice about whether they're going to cut taxes and use our savings accounts to pay for state agency services and supports in the coming years, and or whether they're going to use some of those savings and continuing dollars to provide needed services and supports now and in the future for Iowans with disabilities and Iowans with brain injury. So I think we've got a good opportunity this year because of the fiscal standing of the state in our appropriations areas. In the other two areas, with regards to the guardianship and conservatorship, we've got a Republican caucus that is generally more predisposed to less regulation, less paperwork from state government. And so I would suggest that there is a bit of an inclination to reduce the perceived paperwork burden on guardians and conservatorships. However, in the case of people who are at risk or who the courts are assigning a guardian or conservator, it's because they're deemed often, mostly, quite reasonably, to have a life situation in which their cognition or behavior puts them at risk of abuse, neglect, or exploitation. And so they are assigned either a family member or another community member, most of who work at no charge, to oversee the funding and kind of their essential, again, physiologic and safety needs. These are important roles in Iowa, and 23,000 people might not seem like a lot, but there's a lot of folks in your community and in mine and all of our communities that are in these kind of situations. They don't typically advertise it because it's a bit disconcerting not to have financial and financial independence. So that bill, the guardianship and conservatorship bill, would have a minimum consistent level of planning, basic planning. It would force a conservator or a guardian to think through what are the important parts for this person, given what I know about them, for their health, for their safety, for where they're going to live, for how they're going to work if they want to work, where they'll recreate, and if they, have more education that they either deserve as minors or that they want as adults. In terms of the bill on seizure disorders and epilepsy, again, there are approximately 4,000 students, K-12, that are at risk of epilepsy and or a seizure disorder. Those kiddos, much like any other child, maybe with diabetes or other medical conditions, are their parents, on behalf of us and the Epilepsy Foundation, would have the opportunity to ask for a seizure action plan to be developed around their kid. It would identify key school personnel, including school nurses, but not limited to them, who may administer seizure rescue medications and or treatments, so that it would keep kids from having extended seizures and really preserve their health and well-being. So those are two that rise to the top right now. If you, again, are interested, please reach out to your legislator and or elected official. There's one more place that you can do that, in addition to a phone call and or an email. And many of your elected officials will have listening sessions locally on weekends in your neck of the woods. And we will also post out to you after this session, to everybody who's registered for it, and on the YouTube video in the comment section, some links to being able to find when do legislators meet in various places around the state. So with that, we're right up on the top of the hour, and trying to be respectful for your time and for the time of future listeners. Are there any other questions, June?
No additional questions have come in.
Okay.